Hello, I'm Matthew Koffenberg, physical therapist and owner of Perham Physical Therapy. Today we're going to talk about a common source of back pain. In prior episodes that I have done, we've talked a lot about back pain, and there are multiple sources of back pain. Some of the stuff that we have talked about have included disc-related back pain, we've talked about muscle-related back pain, we've talked about strains. Today we're going to talk about a specific area of back pain caused by what are called facet joints. Facet is spelled F-A-C-E-T. The facet joints are the joints of the spine that create the movement that we need to be able to bend and twist and turn. And a lot of times those facet joints can become dysfunctional, and they'll create a lot of pain. Now, the indicator of facet joint pain is typically pain with movement. So if someone bends forward and then as they're trying to come up, they'll often feel pain. So a common thing that we'll see, or someone will tell me when they come into the clinic, is that, you know, I can bend forward and I feel fine, but when I try to come up, I feel like I've got to grab my knees and I've got to crawl myself up. That's a very typical presentation for facet joint pain. Or people will tell me that, you know, when I'm in bed, I try to turn over onto my left side. I get this sharp, stabbing pain in my low back, and it almost prevents me from turning. Those are two common scenarios associated with facet joint pain. So what exactly are the facets? I have a model here of the spine. The facet joint itself, there are multiple facet joints, but the spine is made up of bones called vertebra, and these are our vertebra. These are the individual vertebra of the spine. Now, where one vertebra meets another vertebra, that is called the facet joint. So I hope you can kind of zoom in here, but this right here, that opening is our facet joint. So we've got a facet joint at each level of the spine, and there's a facet joint on the right side of the spine as well as on the left side of the spine. That is where our movement comes from. So when we bend forward, our facet joint, I hope you can see this. I'm going to take the spine off. But if we zoom into one of these facet joints, so if I were to bend forward, what you'll see is that facet joint kind of gaps and opens. So we'll do that again. So if we kind of focus right in here, when I bend forward, that facet joint opens up. Now when I extend backwards, those facet joints will close. So again, we'll look at this facet joint. When I'm extending back, that facet joint closes. And that's all the facet joints do, is that they open and close. When I turn one direction, so if I'm turning to the right, my left facet joint is opening up and my right facet joint is closing. Now what can happen is one of those facet joints at one specific level can get stuck. So a facet joint can get either stuck in an open position or it can get stuck in a closed position. And there's multiple reasons why the facets can get stuck, and we won't get into that. But what will happen when the facet joint gets stuck, it will cause deep muscles of the low back to spasm. So if we look again at the spine, there are muscles that attach from this point of the spine to this point of the spine. So there's muscles that run like this. Those are called rotatory muscles. When the facet joint gets stuck, those rotatory muscles don't move, and then they go into a deep spasm, which is that deep pain that you get. What's wonderful about facet joint problems is that they are so easily fixable. They can be fixed in one day. What you really want to do is two very simple exercises. The exercises are designed to force the facet to close, or they're forcing the facet to open. So I'm just going to demonstrate the two quick exercises. If you feel like you have facet problems, try these exercises for about a day. If they don't work, you need to come in and see me. Okay? So the two exercises, one that's going to force the joint to open up, is done lying down, and you put one leg straight, you lift the other leg off the ground, grab a hold of your knee, and just rotate over. Now you'll notice I'm keeping my shoulder down and I'm forcing the facet to open with this exercise. You hold that position for about 25 seconds and you do about 5 of them. The other exercise to force the facet closed is you lie down on your stomach. And this will be a familiar exercise in terms of what we've talked about before, but you just do a press up. And then you go back down. And you repeat 15 times. You do that about 3 times a day. And that'll force the facet closed. Now you at home won't know if your facet is stuck open or stuck closed, so do both of those exercises. Should take care of it within 1 to 2 days. If it doesn't, please give me a call. My number is 218-346-2464. Thank you very much.